Hi, my name is Erin Bishop, and I'm a senior here at The Ohio State University. I'm going to talk to you today about the United States healthcare system versus Australia's and kind of compare and contrast some key components that is used to determine whether their healthcare system is considered good or not. So to start, I'm going to talk about their healthcare system. So Australia has universal healthcare, which means that the government provides health insurance to all and it is funded through taxation. Majority of people, though, do also have private healthcare insurance because a lot of times the lines at the public places are long and it takes longer to get an appointment. So this makes it more readily available appointments as well as you're covered for more. So these primary care places are delivered at general practices, community health centers, as well as they also have them at home, so you can get care at home, which is pretty cool in my opinion. These are ran through normal business hours. So what's something awesome that I think they have there that we should maybe try to implement here is that they have a hotline to call after business hours if you have a question. So you can call the hotline and a nurse will pick up and you can tell her your problems that you're having. And she can give you advice, and if they deem that, maybe you should talk to a doctor, then they'll have a general practitioner call you within the hour, which leads you to not having to go anywhere after hours, such as the ER or urgent care or anything like that. And for the U.S. healthcare system, it is private, so we're not funded. We do not get it through our government unless it's through Medicare, which is for the old, or Medicaid, which is for the poor, and that is funded through taxes. So we get ours through, majority of people get it through workplace, and if not, you buy it on your own privately through an insurance company. So first we're going to talk about population health, and we're going to start off with infant mortality. So infant mortality in the United States, about 582.1 per 100,000 live births, and Australia, 320 per 100,000 live births. So infant mortality, to start off, is the probability of a child born and dying before the age of 1. So it is higher in the United States. Premature births and low birth weights are the number one reasons for infant mortality, as long as SIDS and other complications during childbirth. So why are rates higher for infant mortality? Well, studies show that a lot of have lack of prenatal care. A lot of people who don't have insurance can't get prenatal care, or it might not be covered as much, as well as with people like minorities or other undeserved populations might not have as much social capital, which is like friends and family, and might not know about the resources and importance of prenatal care to help with your child's health, which can limit and reduce the rates of infant mortality. So it's really important that we have educational programs, which we do have in both the United States and Australia, to help people know, mothers that are going through pregnancy, know what they need to do, and really stress the importance of prenatal care. Another educational program that was very successful in the United States was the ABCs program. So it's A, for the baby needs to be alone, B, on its back, and C, in a crib. So this will really start to help lower the rates of infant mortality. So for cardiovascular disease mortality, the United States, about 188 per 100,000 people die from cardiovascular disease, and Australia about 182.34. So they're pretty similar. The United States kind of has a higher rate, so more deaths from this. It's actually the leading cause of death in the United States, which is for both men and women, which is kind of insane. Some risk factors that go along with it, like high blood pressure, you're more prone to get cardiovascular disease, obesity, high cholesterol, diabetes, all of those. So policies that focus on it, it's really focusing on lifestyle choices. So your diet, having a healthy diet can help prevent cardiovascular disease, not smoking, making sure you get a lot of physical activity, all of those. So there's a lot of policies implemented promoting healthy lifestyle choices to help combat this. Adult smoking. United States, 15.8% of people, adults ages 18 and over do. Australia, 16%, so these are pretty similar as well. It's also the leading cause of preventable death in Australia and the 7th leading cause of death in the United States. Both of these rates have decreased drastically over the years because of tobacco control programs that we've been doing. So there's, in the United States as well as in Australia, there's a high tax on tobacco products such as cigarettes to try to deter people away from smoking. We also are prohibiting advertising and anything else dealing with tobacco products. And then something cool that Australia has is this nicotine replacement therapy through a pharmaceutical benefit scheme. So the pharmaceutical benefit scheme is through their government, and it's governmentally funded, and it helps us subsidize nicotine patches for those who are trying to quit smoking. So it kind of helps ease them into it, and because Australia is very pro or against smoking, help people quit smoking. So adults with diabetes, United States, 12.6% of adults ages 18 and over. In Australia, 5.1%. So this is a significant difference. This is a huge gap. And the studies show that they think this is because of their higher stress levels in the United States. So this could be from whether it's like unemployment, school. A lot of stressful events in one's life can lead to unhealthy behaviors. So unhealthy behaviors such as like overeating, not eating healthy foods, not exercising, smoking. All of these correlate with diabetes. So it's really important that we have policies targeting healthy lifestyle choices, so dieting, exercising, to help combat this issue. And also that there's, in Australia, a national public service that has like 3 different organizational entities that have a pre-diabetes informational video that they've made, and this kind of helps people get to learn the warning signs of diabetes before it's full-blown diabetes. So this helps prevent it from becoming into diabetes. So adult insufficient physical activity. So once again, this kind of correlates with the diabetes rates in the United States. So in the United States, 79.3% of adults do not meet the requirements for aerobic and strength activity, and then compared to in Australia, 44% do not. So this is huge. So not really sure why the gaps, but what I'm thinking is maybe is it because of laziness in the United States? A lot of people say that we're lazy, we're more prone to driving because we like cars and driving nice things. I know, for example, of me, like just going 2 streets over, Woolies off campus, I'd rather drive than walk. So maybe I'm contributing to this, I don't know. Or is it because of the infrastructure? So let's say in Australia, there's less big cities, everything's kind of closer together, so more people are more likely to walk rather than drive. A story, actually, I was talking to my dad about this, and he said a guy from work that lives in Australia, they walked everywhere, and then when they came to my hometown, he was like, I can't believe you guys just walk to this pizza place, like or drive there, we would just walk there, like that's ridiculous. So it just kind of shows, I think it's just a different mentality, but regardless, I think policies need to be created to help combat this. So maybe I think creating gyms at the workplace, so a lot of times adults after work are tired, don't want to go to the gym, well, they can just work out right at work. And this would also be more effective for the workplace because their employees are going to have better health, so they're going to have less sick days and be more productive at health. So it's a win-win for everybody. Life expectancy. So as I said, United States is going to have lower health expectancy because they have higher rates of diabetes, less physical activity, meeting the requirements, cardiovascular disease. So boys, 76.3 years old, girls, 81.2 in the United States. In Australia, boys, 80.1 years old, and girls, 84.3. So both of these kind of vary by about like 3 or 4 years old. So you're more likely to live in Australia. So like I said, higher rates of diabetes, physical activity, cardiovascular disease, that's why it's higher in the United States. Then also it could be lower in Australia because of universal health care, so they have more preventative care, more likely to go seek out the care when they have insurance, and staying active. And they have more checkups, so if something were to come up and happen, they could attack it earlier before it got full blown. So now we're talking about healthcare spending. So as everyone knows, the United States spends way more than most countries on healthcare, about $9,990 per capita in the United States and $4,357 per capita in Australia. So that's 17.8% of the GDP on healthcare spending in the US and 9.4% of the GDP in Australia. So why are we spending so much? Well, to start, because a lot of people are still uninsured, or maybe they just don't have access to a primary care physician nearby, their method of receiving care is through the ER. And the ER has higher prices of care, so it's going to increase the amount we're spending on healthcare. In addition, in the United States, we're known to do a lot more testing, which costs money, so that's going to increase the cost, as well as we have higher drug prices. So it's a competitive marketplace for the pharmaceutical companies, and they want to make a profit, so they all raise their prices, which causes us to have to spend more. Whereas compared in Australia, they have the Pharmaceutical Benefit Scheme, which is a government-funded organization that creates subsidized prices for prescription medicine, which keeps the costs affordable and them spending less. And also, something I forgot to add, and for Australia, they have the Primary Health Network. It's a government-funded organization that's aimed to really improve effectiveness and efficiency of healthcare services and improve the coordination of care. So this could also lead to, if everything's more cohesive, rather than just going to different appointments and none of the doctors informing each other, so then the process just takes longer, you're less likely to spend money because of this cohesiveness. So average family premium, this is per enrolled employee for employers and employees. So in the United States, it's about $1,475.83 monthly, compared to Australia, which is $615.39 monthly. So that's a significant difference, more than 2 times the amount in the United States. And then $17,710 annually in the US, compared to $7,384.64 annually. So once again, the United States is almost more than 2 times that in Australia. So what is this? Well, once again, it's higher because we spend more money on healthcare in the United States. So that if we're spending more, if insurance companies have to spend more money, they're going to require us to pay higher premiums so that they can make a profit. In addition, we don't have tort reform. So this drives up, in my opinion, the price of healthcare, because, for example, my friend's dad is an orthopedic surgeon. He pays about $170,000 each year just for insurance to cover him for procedures. And because of this, since he's paying so much, the procedure cost is actually increased because of what he has to pay. So that means us, as the people getting the procedures, have to pay more, which increases the premiums and everything else. So that's something that policy talking about right now. Is President Trump going to have a tort reform? Will this work? Will it not? I guess we'll just have to wait and find out. Average single premium, once again, United States is significantly more, $508.42 monthly, $6,101 annually, and then Australia, $2,117.61 monthly, and $2,611.38 annually.